Who is a good candidate for prostatectomy surgery? When considering who is a good candidate for prostatectomy surgery, it is essential to understand the specific circumstances that make a man suitable for this procedure. Prostatectomy, especially radical prostatectomy, is often recommended for men diagnosed with clinically localized prostate cancer. This means the cancer is confined to the prostate gland and has not spread to other areas of the body. The primary aim of this surgery is to remove all cancerous tissue to potentially achieve a cure. Several key factors play a role in determining if a man is a good candidate for this surgery. First, the characteristics of the cancer itself are crucial. Ideal candidates typically have localized cancer, which is assessed through prostate-specific antigen levels, biopsy results, and imaging studies. Generally, candidates have a prostate-specific antigen level of less than 10 nanograms per milliliter and a Gleason score of 6 or lower. However, men with intermediate or high-risk cancer may also be considered based on their individual circumstances. Next, overall health and life expectancy are significant considerations. Candidates should be healthy enough to undergo major surgery without a high risk of complications. This means having no severe heart or lung issues. Additionally, men with a life expectancy of at least 10 years are often viewed as better candidates, as the benefits of surgery tend to accumulate over time. Another factor is the severity of symptoms and the size of the prostate. In some cases, prostatectomy may be performed for benign prostatic hyperplasia, which can cause urinary obstruction or severe symptoms like difficulty emptying the bladder or recurrent bleeding. For cancer patients, the size of the prostate and the severity of symptoms can influence the choice of surgical approach. Patient preferences also play a vital role in the decision-making process. A thorough evaluation by a multidisciplinary team, including urologists, oncologists, and surgeons, is essential. They will consider the patient's preferences, cancer characteristics, and overall health to create a tailored treatment plan. There are different types of prostatectomy, including radical prostatectomy, which involves removing the entire prostate gland and some surrounding tissue, and simple prostatectomy, usually performed for benign conditions. Minimally invasive techniques, such as robotic-assisted laparoscopic prostatectomy, may be options for those with intermediate or high-risk prostate cancer. In summary, a good candidate for prostatectomy surgery is typically a man with clinically localized prostate cancer, good overall health, a sufficient life expectancy, and a cancer profile that suggests surgery could potentially cure the disease. Each decision is individualized and made after careful clinical evaluation and discussion of the risks, benefits, and available alternatives. Always consult healthcare professionals for personalized medical advice.